25-year-old woman who comes to me and says, "Doc, these headaches, I've been getting these terrible headaches very commonly nowadays, and they start off quite mildly. They increase, I'm not able to bring them down, and they become so severe that I'm not able to go to work. Sometimes I just force myself to go to work. I sit there. There are lots of sounds. My colleagues keep talking to me. There are ambient sounds which I'm not able to tolerate. I just wish that everything was silent. I wish that the lights were all switched off. There was nothing bothering me falling into my eyes. I feel pukish. I wish I could puke, but I don't get it. Once I do puke and let out all the vomit, I'm okay. I'm able to relax and I'm a little better, but not completely normal. And sometimes before these headaches, I get these flashes of light, these zigzag lines starting from one side and then slowly moving across my eye, one eye. Then they become larger and larger and larger till they completely occupy one side of my vision, and then sometimes I can't see with one eye. The headache becomes so severe that I want to take off. My boss sometimes doesn't give me permission and I have to suffer there in silence in the office. And sometimes I feel that I need to eat something. I feel hungry, but I don't have the appetite. I feel a low mood during those headaches. These headaches last anywhere between 2 to 8 hours, sometimes the whole day. And these have been occurring quite frequently nowadays, almost or twice or thrice a week. And I've been sleeping less nowadays because of office pressure. And added to that, I've not been eating very much on time. And recently I've been traveling quite a bit. So these headaches are troubling me so much that I'm not able to concentrate. I'm scared of losing my job because my boss thinks I'm not performing as well as I should. This is a typical patient who comes to me with these complaints. What do we make of that? I asked the patient, do you know anyone else in your family who has similar headaches? She said, my mom used to complain of the same things. My sister has the same complaints. Many people think that these are tension headaches, but what you have to remember is there are certain things the patient said which should make you think that this is a migraine headache. Migraine, the word comes from hemicrania, which is one side of the head. Hemi is one side, crania is the head. Hemicrania became migrainea, migrainea became migraine. So that's how this word came about. Pain in one half of the head is considered to be migraine headache. But it's not always that it's on one side. It can be on both the sides. They throb like a pulse, like a heartbeat. Sometimes cause a pukish or nauseated feeling. And people sometimes vomit too. Some of them have an aura. Aura is the symptom that occurs before they have the severe headache. Usually it's visual. There's a flash of light, a zigzag line which moves in front of the eye, covering one angle to the whole eye. And sometimes it may be large enough to obscure vision in that eye. Some people have a tingly feeling on one side. It may be the side opposite to that of the headache. And following this, usually these symptoms last anywhere between a few minutes, 10 minutes to an hour. Rarely more than an hour. If it lasts more than an hour, it should raise the suspicion of something else being there. Once this symptom is coming down, this aura is coming down, the headache starts. The pounding severe headache starts. And that headache lasts for several hours. Along with the headache, they can't tolerate sounds and lights. That's called photophobia, intolerance to lights. Phonophobia, intolerance to sounds. Along with that, they may have a nausea, vomiting. And it disturbs their social or personal or occupational life. This is called migraine with aura. If those symptoms or visual phenomena or the tingling sensation are not there, it's called migraine without aura. Now, some patients get it only once a month, once a year, infrequently. If this happens, they don't need a lot of treatment except to take a painkiller when that headache actually occurs. But if the headaches occur at very frequent intervals, it occurs very frequently, then they need to stop these headaches by giving a preventive medicine. There are many types of preventive medicines available, but people tell me, Doc, I don't want medicines. I don't want to take medicines. You do something, but take me off the medicines and take me off the headaches. Then I think, what do I do? Sometimes lifestyle changes are good. What are the lifestyle changes? Sleeping 8 hours every night is an important thing. In today's world, with the modern pressures, it's difficult, but many people still find time to sleep. Actually, many of us waste time in different ways, and we think sleep is not that important, and so we spend it in other ways. But it's very important to remember that the body, every person needs 8 hours of sleep every night. If you cannot get 8 hours in the night, you should compensate for the remaining time by taking a nap in the afternoons or any time you get during the day. And it's important to eat on time. Missing a meal or delaying a meal can also precipitate these headaches. And there are some foods which can precipitate a headache, like red wine, cheese, chocolates, dark chocolate especially, orange drinks. These can also precipitate migraine headaches. And long distance travel, hot weather or extreme cold weather can precipitate migraine headaches. And in India and some peculiar situations, some people take a head bath and then they have a migraine headache. They go out in the hot sun, they have a migraine headache. So people know what situations they get those headaches. Some people cannot tolerate smells. During those smells, when they smell something odd, they get a headache. And when people know what brings on the headaches, it's easier to avoid these things and then take care of the headaches. Now, as doctors, we always wonder, what type of medicine do we give them to prevent these headaches, to make them occur not so often? When people have more than 2 or 3 headaches per month, usually it means that they need a preventive thing to decrease the frequency of headaches. There are a number of medicines to prevent this. There are beta blockers, there are calcium channel blockers, beta blockers like propranolol, calcium channel blockers like flunarizine, antidepressants like amitriptyline, anticonvulsants like topiramate, valproate. These are all available. We should remember that when we give the medicine, if they have another condition which can be worsened by the medicine that we give, we should try and avoid those medications. For example, if somebody has bronchial asthma, we should try to avoid propranolol. If somebody has a bradykinesia, a slowness like Parkinson's disease, we should try and avoid flunarizine. If somebody has a cardiac condition with a rhythm abnormality, we should try and avoid amitriptyline. If somebody has a liver dysfunction or is obese or has low platelet count, we should avoid sodium valproate. And if somebody has kidney stones, we should avoid topiramate. Many people are obese. They are a little heavier than usual. In those people, and especially in girls who don't like to put on weight, we should try and avoid many medicines which I mentioned, which can make them put on weight. Topiramate doesn't make them put on weight, and that can be given. However, it's not a medicine for everyone. Topiramate can cause some memory disturbances, it can cause dehydration, it can cause kidney stones. Keeping in mind all these things, we should try and give the most suitable medicine for that person. That way, his headache is taken care of, side effects are not an issue. Many people say, I do not want side effects, I do not want to take the medicine daily. What do? Botulinum toxin, which is used commonly for wrinkles and popularly so, is also useful for treating migraine headaches. There are various studies which have shown that it's a very effective medicine and can work wonders for decreasing the number of headaches as well as decreasing the severity of the headaches. And it has become recently quite popular. Of course, it also beautifies you a bit when you take the injection, and so people don't mind it so much. It's an expensive one and has to be taken once in 4 to 6 months, should be given by an expert. So those are the bits which annoy some people, but then many people are okay with it rather than suffer from those cumbersome headaches. In this way, migraine headaches can be prevented. What if you get the headache? Many people take a simple analgesic, and if it's a mild headache, it goes away. But if it's severe, then you need a stronger analgesic. Sometimes you need an injectable analgesic. We have a spate of new drugs called as triptans, which act very specifically for migraine and control the migraine headaches. But people who have a cardiac condition or uncontrolled blood pressure should not take these medicines because it can cause some cardiac problem. And keeping in mind all these factors, migraines can be easily and pleasantly managed if the approach is right. Patients should consult a neurologist once they have symptoms which I have just described to you, typical of a migraine. Discuss their comorbid conditions, other medical conditions which they have, so that the doctor can prescribe suitable medications to prevent these headaches.